This is an audio-only Microdose episode of our interview with Dr. Kultar Garcha, a GP and Global Director of Flow Neuroscience, about tDCS, or Transcranial Direct Current Stimulation. If you'd like to hear more, please do go back and listen to episode 11 in the series, first released in April 2025. Here you can find out more about the promising developments in this technology in the treatment of depression in particular, and enjoy both myself and Matt struggling with a succession of acronyms. We are Beyond the Limits, and this is a microdose of tDCS.
tDCS stands for Transcranial Direct Current Stimulation. It's an electrical stimulation to areas of the brain which are being targeted. The main focus has been around depression. I think that's where the most evidence has been. It's the same amount of current that 2 AA batteries would do in a remote control. That's why you can use it in a headset, you can use it at home, it's safe. What it's doing is it's encouraging those neurons to fire. And so this is why it needs to take some time. You do treatment over days, weeks, for it to just encourage that firing to happen and then cause the effects over time. If we look at the brain in particular, its natural language, the way it works, is through electricity, is sending those signals. So if I focus, say, again on depression, where the most evidence is, what we can definitely say is we don't understand everything there is to know about depression. And there is so much from varying factors, where you live, how you process, genetics, so many components that come in. When we've done scans and studied these, we can identify in many of those individuals that there is an area of the brain, it's the dorsolateral prefrontal cortex, isn't firing as much as it used to when they didn't have depression. When we target that, we're aiming to just start to get that area doing more. Now, the area itself is predominantly around executive functioning, memory, and working memory. So the ability to go and do things and then process them. And this is then when we start to stimulate that again, it's really fascinating when you hear some of the stories of many users, when I've got individual patients of mine who use it, to see what effect it has. You don't necessarily feel it straight away, but we know that area of the brain is what gives us that impetus, that initiative, and that area is where we can see the effects of the technology.
I know there's been a lot of criticism by people in the past that actually antidepressants were born out of this theory that was pushed forward that there was a chemical imbalance in the brain, that was a serotonin deficiency. Although that has now been largely felt to be probably not the case, what would you say to someone who says to you saying that actually we need to stimulate the DPLFC and that is going to be what will improve depressive symptoms? What would you say to someone who says, well, this is just the same thing over and over again?
I'd go back to depression and say there's so many contributing factors. It's a very individual experience. So easy to just label, have a disease, have a condition. I think we have better understanding of many physical conditions. Hypertension, diabetes, and others. I think we have less understanding of depression. So you mentioned around the serotonin theory or the chemical imbalance. And I think, yes, there has been a lot of work more recently to maybe say that's not as much of a feature. We have many users. The studies show that it's a very effective treatment, but it definitely doesn't work for everybody. Nor do antidepressants, nor does therapy. So we've got to think of this as another option, another thing that we can use in the toolbox. Antidepressants can work really well for many people. They have a lot of side effects for many people as well. Now, in my experience, almost always when I've offered it to my patients, they like the option, particularly if you look at the side effect profile and others, they like that. And it's available immediately. We don't have clear evidence that it will, and nor will I ever say that it will work for everybody. But it's a very good option. It can work well. You can add it to other treatments. And I think it will then be an area where I hope many more users can benefit from it.
I realise there's potentially a lot of studies that have been done, but are you able to just give us an idea about what this has actually demonstrated?
So there's been really some good, strong evidence and meta-analyses, systematic reviews, really looking at the robustness of the evidence. And we would say that now, and it's sort of class A. So it's very strong evidence for the positive effect it has for depression. There are other diseases that it can cover, but if we focus on depression, we can see that it definitely has good results. Yeah, most evidence is around the DLPFC, showing a positive effect at between 40 and 45% of our users also being in remission at 10 weeks. So really encouraging results.
How do patients wear this? How long do they have to wear it for? Does it, how is it expensive? Talk us through how it actually works.
So the device itself it doesn't even need to be prescribed. So this is actually available over the counter, and the majority of our users are those who have been self-purchased. We've got many users who are also then given the device, prescribed the device by their doctors. The treatment itself, so the headset, this is not something that you have to be in the clinic for. So yes, even if people buy it online and get it, you use it at home. It's app controlled. The app guides you through putting it on. It's super simple. You wear it for 30 minutes and you do that once a day. And for the first 3 weeks, you use that 5 times a week. So in total, you're wearing it for 2.5 hours a week at home for 3 weeks. About 75% will have noticeable effects even at 3 weeks. But we want these to be long lasting. We know about how many people with depression can relapse. So we say a minimum of 10 weeks. And then depending on their chance of relapse, the chance of symptoms coming back, or how many symptoms they continue with, that can extend for longer.
I'm going to ask about how you see the future for tDCS. It sounds like there's an ambition for this to be ubiquitous throughout primary care and available and accessible for anyone suffering with troubling depressive symptoms. What does the future hold?
I'm just really excited about this space more broadly. There is so much about depression that we don't know. But let's for a second sort of probe depression itself. Think about perinatal depression. So antenatal, postnatal, that subset. Think about adolescence. Now, the treatment options there are far more limited. I really think this has got an amazing use case, and we'd love to do the research and just exploring those. So we've got depression. That's the indication of usage at the moment. My overall practice, I really understand diagnoses and conditions. Like I of course, I work within that framework. But at the same time, why should it be until you reach a certain point? So what I'm equally excited about is to mood more broadly. So what about if there are precursors, similar to how we have, say, pre-diabetes, or if people are starting to get a high blood pressure? What if we start to see there are aspects of mood here that may turn into depression? What about having it there as an option? So even before it starts, it's almost like a preventative space. And then on the other side, what about if you're well, and what are the opportunities here about performance? What about the opportunities here of using brain stimulation to enhance or get you even better as a baseline? I think that's a really fascinating area to explore around sort of depression and mood. Yeah, there is some evidence again around this helping with performance. What does that look like? Definitely an area I'm super interested in. I think it does have a role to play. I'm very optimistic that there is a space here that we can look at. We absolutely need to be careful. I'm not saying this is ubiquitous. You pick up a headset as soon as an experience happens. Being low is a very normal and natural and the right response to have to situations. So this is not to say, right, immediately let's turn to, and we don't, and we wouldn't prescribe that scenario. Similarly, even though this to be very much safer, it's still not the thing to say, right, just use this. So there is a lot around just still the educational space around this is what emotions are, this is how we process them. It's very normal to have these reactions and these adjustment reactions to conditions. But where we have, say, a diagnosis or those who have those chronic symptoms, absolutely. I think here one of the challenges that I have in my area, I think many people around the country and in other countries, again, will find is sometimes it's easy to prescribe. I mean, look, I've been guilty of this when I would love for somebody to be referred into therapy and go through behavioral therapy, but the wait lists are very long and they're really struggling. And of course, we don't want them to. So I may not be massively keen on prescribing but it's what I have available to me, because at least it's something. And here, it's immediately available as well. And even while they are waiting. So why not try? It's very low risk. And this is, I think, the area where we can. If you're not really responding to treatments or having a suboptimal response, you can add this in. You could also use it right at the beginning, even while you're exploring other treatments. Let's see how that space unfolds.